Hi, my name is Chelsea. I am one of the nurses here at the hospital, and I'm going to be the one attending to you today. Really quickly, can I just have you verify for me your name and date of birth? Perfect, okay. And do you know where you are? Okay. And do you know today's date? Perfect. Yeah, we ask those questions from all of our patients. It's a way of us to do kind of like a cognition check. So. Really quickly, I'd just like you to focus your gaze right there, right in between my eyebrows. Okay. Good. And then don't move your head at all. I'd just like you to follow my light, just using your eyes. Yeah, good. Okay. Good. Okay. Sorry for the intense eye contact, but it's really important that when we have patients present in the ER with a number of different symptoms, that we really make sure we don't miss anything. So that's why I'm really staring at you there. Okay. And are you okay temperature-wise? Would you like another blanket or anything? Okay. Okay. Yeah, we can help you get warmer, but getting cooler is a little bit more challenging. But if you need, I can provide you with some ice packs. Okay, just let me know. But okay. Can you tell me a bit about what brought you in here today? Okay. Okay. Let's take your temp then. Okay. So this just goes right under your tongue towards the back of your mouth. Perfect, okay? And then if I can just have you close your mouth. Good. Okay. Take that back. So your temp is at 102.6 Fahrenheit. And that's about where you were measuring it at home. Okay. Yeah, you probably are feeling pretty uncomfortable. Then before I ask you any more questions, I'm going to get you hooked up to the monitor. So, in just a second here. Nope, that's not that. Okay. So this just clips on your finger, just like that, okay? And we'll feed this around your arm. Okay, you're going to notice that that's going to be intermittently tightening and loosening. But first I have to turn the monitor on. But anyway, it's not going to be continuously measuring your blood pressure. It's going to just be kind of sporadic. Why are you not turning on screen? There we go. There we go, okay. Put that on silence. It is connected to our Wi-Fi, so if anything changes, we'll get an alert. Let's see. Okay, so now that we have you hooked up, I just have a few questions for you, okay? Okay. Are you okay with everything? The blood pressure to cuff, is it too tight or anything? Okay. And would you like me to tape the pulse ox clip to your finger? Do you think that would be better? Okay. Well, if we need to, we can always do that. But okay, so I know you have a headache. If you were to rate the pain on a scale of 1 to 10, how would you rate that? Okay. And when the headache started, was it at that intensity or did it gradually build up? And where is the headache? On your head? Okay. Any confusion, dizziness, loss of consciousness? Okay. Any kind of like extremity weakness or tremor? You said you had a fever. Any chills or night sweats? Okay. Any shortness of breath, feeling like your heart is racing, or chest pain? Okay, a little bit of heart racing. That can be part of having a fever, but we'll keep an eye on it and probably hook you up to EKG in just a moment here. Any nausea or vomiting? History of diabetes? History of asthma or COPD? Let's see, have you traveled outside of the country in the last 60 days? Any history of anxiety or depression? And any food, medication, or material allergies? Yeah, a lot of people don't tolerate food dye very well. My son is one of them. Alright. So before I go further, first I want to listen to your chest. And then I'm going to hook you up to EKG, just so that way we can kind of keep track. My guess would be that the increased heart rate is probably just related to the stress and discomfort of your elevated temperature, but we just want to be really careful. So, okay. Can I have you take a deep breath in for me? And out. Good. And again. Again. Now if I can just have you lean forward just a little bit, I'm just going to listen to your back. So, another deep breath. Good. Okay. Other side here. One more deep breath. Okay. Your lungs sound good, nice and clear. And I do hear a bit of an accelerated heart rate. Not too bad, 96 beats per minute. It's a bit on the high side, so we'll just keep an eye on it. So we have these little stickers, which are leads that I'm going to be attaching to your chest, okay? And then I'm going to attach what we call our spider, which are these electrodes that will help us record and monitor your heart activity. So I'm just going to open your gown just a little here. I'm going to have to palpate you a bit because I need to make sure that I'm feeling in between your ribs. If I put a sticker on your ribs, it's not going to be able to get a correct reading. Yeah, sorry about that. The emergency department is on the opposite wall of the ambulance bay, which makes sense if you think about it. But it does mean that we get some car sounds in here pretty loudly. But as we do have frequent patients who have some sensory sensitivities, if you need some earplugs, we can provide those for you. Okay, and just let me know, okay? Alright. Sorry, I just need to make sure that this cord doesn't have any kind of kinks in it, which looks like we're good. So that's just going to be recording. It's not going to make any kind of noises, okay? Okay. So then... Oops. Going to do an examination with you, okay? I'm going to do my best to keep it as comfortable and non-invasive as possible. That being said, just a second, I'm getting a page. Okay. Not a big deal. Sorry. I'm going to do my best to keep the exam as non-invasive as possible, okay? If at any point anything becomes really overwhelming for you, let me know, alright? Okay. So I'm going to start just by kind of feeling your head. So this is where you're feeling the pain. Is it okay with me pressing on it? Just feeling temporal pulse here. That all feels okay. I'm gonna take a peek inside of your ears, so you'll have to forgive me for kind of leaning over you. Let me just make sure I don't step on these cords. Okay. So. This ear looks good. It's nice and clean. No evidence of any kind of redness or inflammation. Take a look at the outside. And of your ear. This ear looks good too. Not seeing any kind of fluid or irritation. Internal ear looks good. Switch out. Take a quick peek inside of your nostrils, okay? Good. All right. Quick check of your airway. So I'm going to just have you open. This is going to press down on your tongue. Great. Okay. Good. Nice and clear. I'm going to pull out my tongue depressor and just take a look. Can you lift up your tongue for me? Great. All right. You can close your mouth and relax. Okay. And I'm going to take a look at your eyes. First, I'm just going to use this light, and I'm sorry, I'm going to have to kind of shine it at you for a few minutes here. Okay. Your eyes are a little bloodshot, but no sign of icterus, which is when the white parts of your eyes turn yellow. Can indicate an issue with your liver. They look okay. Now I'm going to look inside of your eyes. So try to keep them open. I know it's not comfortable. that's enough of that. Are you okay? Did that cause any kind of strain or increase in pain? Okay. Listen to your tummy. Okay. Let me know if anywhere that I'm pressing is tender. Okay. And tenderness back here around your kidneys. Okay. Good. Okay. Gonna check your extremities, your arms and legs for any sign of edema. Okay. So what that means is I'm going to be kind of pressing and releasing and seeing how long it takes for the color to return where I was pressing. Okay. Okay. And like I said before, any areas that are tender, let me know. Okay. Any sensitivity, tenderness, or pain anywhere where I was pressing? Okay, good. So then what I'd like to do is draw some labs, okay? And start an IV of just some normal saline, which is going to help you feel hydrated and stay hydrated. And then also if we need to administer any medication, you'll have an IV already done. All right? Okay. So I'm going to take a look at your arm, okay? Let's check the other side. I know we have a blood pressure cuff there, but no, I think this arm. Okay. 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 It's going to be a bit on the tight side. I apologize. And our tape. Okay, so if I can have you just kind of pump a fist for me. Great. And hold that fist. Okay, gonna feel a poke. 3, 2. keeping that in place for a moment. Yeah, that was a pretty good crack, wasn't it? Both knees. Okay. All right. I'm going to put a transparent dressing over the IV site because it's going to help keep it dry, and also if we need to move you, it'll help everything stay put, not have any risk of being yanked out. Okay. 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 How are you feeling after that? You doing okay? Okay. Feeling any kind of lightheadedness at all? Okay. And any change in the intensity of the headache? It's the same. Okay. All right. Sorry. So, I'm going to go and get your labs processed. I'm going to have them run stat, so that way we have as much information about you available as soon as possible. And I'm also going to be discussing our exam with Dr. Cozy, who will be your attending physician. She'll be in shortly to do her own assessment, but she always sends us in first, so that way we can alert her to any red flags and she knows what to focus on if needed. But that being said, you shouldn't be in here too long by yourself. If you need anything at all, there is a call button right there on the remote. That little, like, kind of person icon, that's the button. It also controls the TV, so if you want to watch something, we do have basic cable channels available. Okay. Are you okay temperature-wise still? Are you still feeling kind of warm? Okay. Do you think you'd like me to get you an ice pack? Okay, it's not a problem. But if you change your mind, just push that button and myself or another nurse or nursing assistant will come in and get that for you. And same thing for the sound. Are you okay? Do you need earplugs or anything? You're still okay? Okay. Do you have any questions for me before I step out? Okay. Like I said, any of that changes, just push that button and myself or someone will be right in. Okay. You sit tight, okay?